Imagine you're facing a simple scratch, and instead of it healing quickly, it just keeps bleeding. That's when the role of platelets comes into focus. Every moment, right now, these tiny blood cells are actively working to keep your blood inside your body where it belongs. But what happens when there are too many or too few of them? This is something most of us overlook, yet it can play a major role in our health. What are platelets, and why are they important? Let's get down to the basics. Platelets are tiny cell fragments in your blood that help it clot. Think of them as the body's emergency response team, rushing to the scene whenever there's damage to a blood vessel. They patch up injuries to keep blood from leaking out. Without them, every little bump or scrape would be a bigger problem. These fragments actually come from much larger cells called megakaryocytes, which live in your bone marrow. Platelets break off from these cells and circulate through your bloodstream, ready to spring into action whenever they're needed. Platelet count, what's normal and why does it matter? Now, let's talk numbers. For years, the normal range for platelet counts in adults has been set between 150,000 and 450,000 platelets per microliter of blood. But there's more to it than just hitting these numbers. Research shows that your platelet count can vary with age, sex, and even lifestyle factors. A large-scale study across Italian regions, for example, observed how these counts change, not just over time but based on who you are. And recent studies in Switzerland reveal that these changes aren't just random. While female platelet counts remain fairly stable over time, men tend to experience a decline in platelet numbers as they age. So, the typical range may need some rethinking based on age and individual characteristics. Why do platelet counts change with age? You might be wondering why platelets fluctuate as we get older. It turns out there are a few key reasons for this. 1. Bone marrow changes. Bone marrow, where platelets are made, changes with age. As we grow older, our bone marrow may slow down or alter the type of cells it produces. 2. Blood composition. Over time, the makeup of our blood plasma shifts. This shift affects how blood cells, including platelets, interact and function. 3. Vascular aging. Our blood vessels age, too. Just as pipes can corrode over time, blood vessels undergo changes, making it harder for blood to flow as easily. Platelets adapt to this change, often affecting their overall numbers. These factors aren't fully understood yet, but researchers are actively working to find out more. What happens when platelet counts are too high? High platelet counts, known as thrombocytosis, mean that blood is more likely to clot, which can be a problem. There are two main types of high platelet counts. Primary thrombocythemia. This condition isn't caused by another illness but occurs due to a problem in the blood itself. It's when your platelets just go into overdrive without any external trigger. Secondary thrombocytosis. Here, high platelet levels are a reaction to another health condition, such as an infection, inflammation, or even certain cancers. Both can be risky. Imagine platelets creating clots where they aren't needed, blood clots in places like the brain, feet, or hands. This can lead to severe health issues, like strokes or heart attacks. But it doesn't stop there. High platelets can lead to strange problems like nosebleeds, when unnecessary clots consume the platelets your body actually needs. What about low platelet counts? When platelet counts dip too low, below the 150,000 per microliter mark, it's called thrombocytopenia. This condition can make it hard for your blood to clot properly, so even minor injuries can turn into bleeding issues. Some symptoms of low platelet counts include unusual bruising or spotting on the skin, heavy menstrual bleeding, bleeding gums or frequent nosebleeds, blood in urine or stool. Thrombocytopenia can result from various causes, such as exposure to certain chemicals, medications, lifestyle habits, or even genetic factors. It can also stem from underlying health conditions, like liver disease or autoimmune disorders where the body mistakenly attacks its own platelets. Platelets and health. What do the numbers mean for you? Your platelet count can give doctors valuable insight into your health. It's a diagnostic tool that helps them understand how your body might respond in situations where blood clotting is crucial. If your numbers are off, it might mean you're more likely to experience blood clotting or bleeding issues. In the world of health, knowledge truly is power. If you know where your platelet levels stand, you're more equipped to take steps to maintain your health and respond to potential risks. If you're someone who's had fluctuating platelet counts or a history of clotting disorders, staying informed is even more essential. Why should you care about your platelet count? If you've never thought about your platelet count before, now's a great time to start. The signs of high or low platelet counts aren't always obvious, but their impacts can be life-changing. Platelets are at the core of wound healing, blood clotting, and overall health. They are a measure of how your body responds in times of need, and knowing your numbers can help you catch potential health issues before they become more serious. So, next time you're at the doctor's office, ask about your platelet count, especially if you have a family history of clotting disorders or experience symptoms like easy bruising or prolonged bleeding. It might just be the key to understanding an important aspect of your health. Conclusion. Understanding your platelet count can feel like peeking behind the curtain at one of the body's most essential processes. Platelets aren't just numbers on a lab report, they're a real measure of how well your body can protect itself. As researchers continue to explore the connection between platelets, age, and health, you can stay ahead by keeping an eye on these tiny yet powerful components of your blood. So, remember, your platelets are more than just a statistic. They're a sign of your body's resilience and readiness. Keep informed, stay aware, and take control of your health with this simple yet essential knowledge about your platelet count.